So first I would like to ask for you both permission to use this video for educational purposes.
Yes, that's fine.
Okay, now, why don't you know, it's this kind of thing is always a family thing, and family suffers always with us. Why don't you describe how long did you have pain and how long was it really bad before the surgery?
Well, he's always had back pain over the years from previous accident when he was 19, but...
The year,
Yep.
it was really bad, 1 to 10, how bad was the pain?
He would fluctuate up to anywhere from a 6 to 9.
And, you know, how was the daily activity and walking?
That decreased every month that went by. It got worse and worse, where he couldn't walk over 50 feet.
And you told me that you have seen other surgeons.
Yep.
What did they tell you?
We saw a surgeon down in the cities who wanted to do the anterior fusion levels of L4 to L5 and L5 to S1. Want to go from the front and then open him up in the back and have a general surgeon with him as well. So the surgery would take 6+ hours.
6+ hours, which is realistic. You wanted to do ALIF procedure, and you saw another surgeon. Tell me about that.
Our insurance Travis had 2 discograms done. One didn't have a CT scan, and then the second one had the CT scan following. When we went in to see this in-network provider, he walked in, shook our hands, and said, I've looked at all your scans, I looked at your MRI, and I'm sorry, but there's nothing I can do for you.
And he mentioned again and again that, you know, Travis is a big guy.
Yeah. He said you need to lose weight, and that may help with your problems, but it won't make them all go away.
Yeah, we did the surgery about a month ago, right?
Mm-hmm. And prior to surgery, his main complaint of pain was testicle pain. He'd have shooting testicle pain for the last 9 months, and the doctor said there's nothing we can do for that.
So what we did about a month ago, we did this L4-S1 OLLIF, this minimal invasive procedure, and practically we did look at the discogram, all the results, and we noticed that the problem is coming from L4, 5 and L5-S1. And the surgery just was about a month ago, and I'm here to have the data from the surgery, which shows the surgery took only almost 1.5 hours, and our blood loss was barely 65 cc. And tell me, how long did it take you to walk after the surgery?
I was walking that night.
That night, just a few hours after the surgery?
Yeah, not even
and
9 hours after surgery.
Yeah, and you actually you were discharged what?
The
next morning. How was the pain then after the surgery?
Pain now is a 1.
Pain is now 1.
He has no numbness in his leg anymore.
So the problem for all practical purposes solved now.
Yeah.
Is that correct?
Yeah, he has no testicle pain.
Yeah,
no
and
pains at all.
in a surgery that took us just 1.5 hours, we didn't have to open your belly. We didn't have to go from the front and back. And you know, your surgery was obviously a little more than a usual surgery, because this surgery for 2 levels is actually usually for us just 1 hour. Yes, we added half an hour to the surgery, but this was a doable surgery for us.
Yeah.
And the results are obvious just 1 month after the surgery.
Yeah. He's off pain meds and his gabapentin.
Yeah, what would you say to the surgeon who told you you cannot be helped now? What would you say?
Oh, we were really angry. We left really angry that day.
No, but you know, just in practical senses, I think this should be a teaching experience.
Yeah.
If you could meet the surgeon again, what would you tell that surgeon?
We were disappointed.
Yes,
you know, that...
and I apologize for my profession. We disappoint patient a lot because we don't keep ourselves up to date. What are the possibilities?
Yeah, I think, you know, maybe broaden his horizons a little bit, look at something new.
Exactly. I think that's what this video about, to all seems to be.